So how does the 5 levels relate to Lyme disease? Let's start with the first level, the physical level. For those of you out there who are Lyme patients, you know there are no 2 patients that present with the same symptoms. Possibly it's one of the reasons why it's hard to detect, it's hard to diagnose, and it's hard to treat. I have some patients that the visual disturbances are so great they've taken to not be able to drive their car anymore. For others, it's an inability to not only get to sleep, and for others, they can't stay asleep. For others, it's an imbalance in every movement. They may be walking along and all of a sudden they get dizzy and have to sit down, or going from a lying down to a standing up position, the room begins to spin. The physical level, this is where my patients come in with literally suitcases of supplements. They've read every Lyme blog out there, they've read every article, and every time they hear about a new treatment, they go and they buy it. And which one works? Again, that's where autonomic response testing comes in, because using that we can actually fine-tune it and customize it. On the second level, that's our energy body. One of the tools that we use in my office is something called heart rate variability. Basically, this is called a rhythm graph, and hooking the patient up to a monitor, we can see what their rhythm graph looks like. This rhythm graph is actually of a patient who's very healthy. They have a lot of adaptability. This is the patient testing lying down and then standing up. Unfortunately, with our Lyme patients, their graphs look very different. Basically, the graph is flat. It means that the autonomic nervous system does not have a lot of adaptability. And from an integrative or holistic perspective, we define health as basically when the organism can adapt to its environment, whether it's a physical stress, an emotional stress, or a chemical stress. The third level, we talked about that as our mental body. And we talked about it as the place where we form our beliefs and our attitudes and our thoughts. So one of the things we try to be really careful with is not have our patients walk around and say, I have Lyme disease, because oftentimes we begin to change our physiology to match the diagnosis. And the truth is that we are not our Lyme disease. It's just a diagnosis, and it's important to not have our beliefs. Oh, some people say, once you have it, you'll never get rid of it, or I'll never be well. This is third level work, and this is where Dr. Nancy really excels with her work with neuroemotional technique. The fourth level is a level beyond the mind and often beyond language, which is one of the reasons why family constellation is so powerful and effective. We talked about the idea that dis-ease can often come from a break in the link of the family system. Well, one of the ideas behind Lyme disease is that we feel disconnected from our clan. We don't know where we belong. And using family constellation, we can identify where in that family system that disconnect may have occurred and use that system to correct it. Sometimes Lyme can actually waken up a memory that the patient has forgotten. Basically like a child healing, the doctor telling the mother, if you don't wipe out this blank disease now, little Johnny will die. And then there becomes an exposure later in life, and that memory is reawakened, and the person becomes more vulnerable to that particular infection. What we've also recognized is that one of the reasons why patients present so differently with Lyme disease is because it'll often attack the weakest place. So if a person had a knee injury or a neck injury or gastrointestinal distress, that's where the Lyme presentation will be most acute. And then there's the fifth level. We talked about the fifth level as higher consciousness. Love. Love is the greatest healer. So when we're working with our patients on the fifth level, this is where we direct them not only to, it begins with self-love. And we start to look at the Lyme diseases, not the enemy, but what have you come here to teach me? because oftentimes Lyme patients will report that Lyme was the worst thing that ever happened to them, and many times the best thing that ever happened to them. It created a foundation for them to stop and reflect, to go back and review their life and see what is the journey that they've been on so far, and to examine where they are, not only now, but where do they want to be in their future. The 5 levels of healing has been a wonderful tool. It is beyond body, mind, and spirit, and any health condition, when assessed and examined according to that level, can be treated with great results. Lyme has been called the great imitator. It mimics so many diseases: autism, mercury toxicity, ALS, MS. Borrelia burgdorferi has been isolated in every single body fluid, including colostrum, the mother's milk. We know that it's not just transmitted by a tick anymore, but in fact it crosses the placenta. And if any of you have watched Jesse Ventura and his Plum Island reference, there's many theories about what and where and why. So I'm going to leave the conspiracies to the experts, and I'm just going to do what I do best, which is work through the 5 levels with each and every patient. If you're interested in learning more about it, please go to our website at multiplekineticsystems.com, follow our blog, or tweet me at Dr. Sharon Rasa. Thanks for tuning in. Let's get well together.